All right, so now we're going to talk about the cardiac cycle. So we're at 19.3 here. We'll start here. The period of time that begins with contraction of the atria and ends with ventricular relaxation is known as the cardiac cycle. So the whole process from the atria contracting, then the ventricles contracting, is all going to be part of the cycle, and then relaxation after that. So the period of contraction that the heart undergoes while it pumps blood into circulation is called systole. So systole is the period of contraction, and then diastole is the period of relaxation that occurs as the chambers are filling with blood. Okay, so both the atria and the ventricles are going to undergo systole and diastole. So both the atria at the top are going to undergo a period of contraction, systole, and then relaxation, diastole. And then the ventricles, systole and diastole. Let's take a closer look at that. So we'll come back to this image in just a moment because we're going to talk about those different parts, and then we'll come back to that. So first, let's talk about pressures and flow. So fluids, whether gases or liquids, are materials that flow according to pressure gradients. So it's going to go to the area that's from highest in pressure, so an area from high pressure to an area of low pressure. And we can see this in everyday life very often. So when something is squeezed, if you have like a balloon filled with water and you squeeze it, that's putting high pressure, and it's going to try to force its way to an area of low pressure. So if it's a balloon that's open, you can squeeze it, it's high pressure, then the water will come spurting out of the balloon. And we see that just in everyday things as well as in the heart. So here, accordingly, when the heart chambers are relaxed, which is diastole, blood will flow into the atria from the veins, from the superior and inferior vena cava, and then also from the aortic pulmonary veins, which are higher in pressure. So blood coming from the body is going to be pumping it up to, for example, the inferior and superior vena cava. And so those are going to be high in pressure. And the atria is going to be more empty. So it's going to be pushed into the atria. And then as blood flows into the atria, the pressure will rise in the atria, or atrium, if we're talking about the right side. And then it's going to passively move from the atria into the ventricles. So it's just moving to the area of least resistance. It's going to go from the atria, because those are getting full and pressurized, and it's going to drip down into the ventricles now. When the action potential triggers the muscles in the atria to contract, so the top part of the heart, when we have atrial systole, the pressure in the atria is going to rise further, and then that's going to pump the blood into the ventricles. So it's going to be pushing that blood down into the ventricles. During ventricular systole, the pressure rises in the ventricles then, and then it's going to pump blood into the pulmonary trunk from the right ventricle and the aorta from the left ventricle. Again, as you consider this flow and relate it to the conduction pathway, the elegance of the system is apparent. So basically, we go from the inferior and superior vena cava, which have a high pressure, drain into the atria, which at that point has a lower pressure, and then when it starts to fill up, has a high pressure. So then the blood is going to be flowing down into the ventricles. The ventricles fill up, high pressure, they contract, and then the blood is going to be pumped out through the aorta or the pulmonary trunk, and then that will have higher pressure, and then we go through this cycle over and over and over again. So let's look at these phases then. At the beginning of the cardiac cycle, both the atria and the ventricles are relaxed. So the beginning of the cardiac cycle, we're saying the heart is totally relaxed. We have atria diastole and ventricular diastole. So blood is flowing into the right atrium from the superior and inferior vena cava and the coronary sinus. So remember, the coronary sinus is the blood flow that is coming from the actual heart itself. Blood flows into the left atrium from the 4 pulmonary veins. So remember, coming from the lungs, we have the pulmonary veins on the base of the heart, kind of posterior, draining into the left atrium. Then we have our 2 atrioventricular valves. Remember, the tricuspid, which is on the right side, and the mitral, which is the bicuspid on the left side, are both open. So the blood is going to flow directly from the atria down into the ventricles. Approximately 70 to 80% of the ventricular filling, so the amount of blood that's going to be in the ventricles, occurs just by this active draining, this pouring of blood from the atria down into the ventricles. The two semilunar valves then, the pulmonary and aortic valves, are closed. So those are the valves that are holding stuff in the ventricles. They are closed, which is preventing backflow of blood into the right and the left ventricles from the pulmonary trunk on the right and the aorta on the left. Okay, so we have our tricuspid and bicuspid valves that are open. Blood is pouring into the atria and then also the ventricles. The ventricles are getting about 70 to 80% of the blood that they will get. And at this time, the pulmonary and aortic semilunar valves are closed. So let's take a look at the atria first. We're going to look at systole and diastole in the atria. So contraction of the atria follows depolarization, which again is represented by the P wave of the ECG. As the atrial muscles contract from the superior portion of the atria toward the atrioventricular septum, so they kind of contract from the top outside, squeezing down toward the ventricles. The pressure rises within the atrium, and then blood is pumped into the ventricles through the open atrioventricular valve. So on the right side, we're talking about the tricuspid, and on the left side, we're talking about the bicuspid. At the start of atrial systole, the ventricles are normally filled with about 70 to 80% of their capacity. All right, so we said that just that draining of blood going right through those valves, since they're open, that'll always already get 70 to 80% of it. Then this atrial contraction, also called the atrial kick, contributes just the remaining 20 to 30% of the blood. So 70-80% drips into the ventricles, and then the last 20-30% is squeezed into there from the contraction of the atria. Atrial systole lasts about 100 milliseconds and ends prior to ventricular systole as the atrial muscle returns to diastole. So we're saying that we have that contraction of the atria, that's our systole, lasts about 100 milliseconds, and then that ends before the ventricles contract. So now let's take a look at ventricular systole. So it follows depolarization of the ventricles, represented by the QRS complex. It may be divided into two phases, so we're going to take a look at those. Lasts about 270 milliseconds. At the end of atrial systole, and just prior to atrial contraction, the ventricles contain about 130 milliliters of blood in a resting adult in a standing position. So this is just average number, 130. This volume is known as the EDV, or the end diastolic volume. Okay, so this is the end of diastole of the ventricles, because now we're moving into systole of the ventricles. So the end diastolic volume is 130 milliliters of blood. So initially, as the muscles in the ventricle contract, the pressure of the blood is going to rise because we're squeezing on it, but it is not yet high enough to open those semilunar valves, the pulmonary and aortic valves, and be ejected from the heart. So we're building. So we've got this squeezing that's starting, the pressure is rising, so the blood's filling up the ventricle space. And at this time, it's not enough to push it through the aorta or through the pulmonary trunk. However, it's rising enough to where the atria is a lower pressure area than the ventricles are. And then what happens is the increase in pressure in the ventricles is going to cause the blood to flow back toward the atria, and then that's going to actually close the tricuspid and bicuspid valves. Since blood is not being ejected from the ventricles, the volume of blood within the chamber remains constant. So we haven't added any blood or taken any blood away at this point. We've just increased the pressure, closing those valves to the atria. So this is known as isovolumic contraction or isovolumetric contraction, which is the one that I typically use, isovolumetric contraction. In the second phase, so that was the first phase. In the second phase of ventricular systole, we have the ventricular ejection phase. Okay, so we call this the ejection phase because it's very easy to remember that way. This is when the blood is going to be ejected from the ventricles. So the contraction of the ventricular muscle has raised the pressure within the ventricle to the point that it is greater than the pressures in the pulmonary trunk and the aorta. So then blood is pumped from the heart, pushing open the pulmonary and aortic semilunar valves. The pressure generated by the ventricles will be greater than the pressure generated by, or the pressure generated by the left ventricle is greater than the pressure generated by the right ventricle. Remember, the left side has to go to the entire system, and it is has a much thicker layer of muscle around it than the right side, because the right side only has to go to the lungs. But even though there's a higher amount of pressure on that left side, they both pump the same amount of blood. This quantity is referred to as the stroke volume. Okay, so the amount of blood that is ejected from the heart, right, ejected from the ventricles, is called the stroke volume. And that's normally about 70 to 80 milliliters. Since ventricular systole began with an EDV, remember, an end diastolic volume, an EDV of about 130 milliliters, this means that there's still about 50 to 60 milliliters of blood remaining in the ventricle. This is known as the end systolic volume. Okay, so remember, systole is the contraction part. So at the end of the contraction part, end systolic volume. This is the volume of blood that is still left. So about 50 to 60 milliliters. So that's ventricular systole. Let's talk about then ventricular diastole. So that's when the ventricles are relaxed, and it follows repolarization of the ventricles, represented by the T wave on the ECG. It is also divided into two distinct phases. During the early phase of ventricular diastole, as the ventricular muscle relaxes, pressure on the remaining blood within the ventricles begin to fall. Okay, so in the ventricles, they're relaxed now, which means they're much larger, or they're starting to be larger, and so the pressure in the ventricles is starting to fall. When the pressure within the ventricles drops below the pressure in the pulmonary trunk and the aorta, blood flows back toward the heart, producing the dicrotic notch, or a small dip seen in blood pressure tracings. So we see this little dip because we have the blood pressure dropping, and it's going to be lower than in the aortic arch and the pulmonary trunk, and it kind of flows back a little bit. The semilunar valves then close to prevent backflow into the heart. Since the atrioventricular valves are closed at this point, there is no change in the volume of blood in the ventricle. So the early phase of ventricular diastole is also, or is called, the isovolumetric ventricular relaxation phase, or isovolumetric ventricular relaxation phase. So isovolumic or isovolumetric ventricular relaxation phase. In the second phase then of ventricular diastole, which is called the late ventricular diastole, is when the ventricular muscles are completely relaxed, pressure on the blood within the ventricles drops even further, and then eventually it drops below the pressure in the atria. When that happens, then the blood is going to flow from the atria into the ventricles, pushing open the tricuspid and bicuspid valves. As pressure drops within the ventricles, then the blood is going to flow from the major veins into the relaxed atria, and from there into the ventricles, and we start over again. So at this point, the ventricles are completely relaxed, and then that's going to allow the blood to flow from the atria down into the ventricles, opening up those atrioventricular valves. So both chambers are now in diastole, which, remember, was the beginning of the cardiac cycle. The atrioventricular valves are open, the semilunar valves remain closed, and the cardiac cycle is complete. So why don't we go back up to this image and kind of connect those dots there. So here is where we have atrial contraction. It starts with the atrial systole. So kind of right in here is where we have diastole of both the atria. So like right here we have diastole, both atria and the ventricles. And that's going to be at this point here on the ECG. So we start there, both are resting, and then we move into our atrial contraction phase. So this is where you can see it's a darker color here in the atria. They're getting darker because you can see these arrows. The contraction is starting to happen and starting to push the blood down into the ventricles. Then it finishes squeezing that, and then the blood is now in the ventricles here. Then we have our ventricular contraction. So the pressure is going to start to build. So this is the early or the first phase. The pressure starts to build, so we see this closing of our atrioventricular valves. So the tricuspid here on the right and the bicuspid on the left. Those are closing, but at this point you can see our pulmonary semilunar valve and our aortic semilunar valve are still closed. Then in the second phase, the pressure has increased so much, you can see the decreased space here because of the increase in pressure, our contraction. We still have our atrioventricular valves closed, but at this point we have our semilunar valves open, and we can see the blood now flow into the vessels. Then we have relaxation. So this darker green was ventricular systole when the contraction was happening. And now over here we have ventricular diastole. So now we have relaxation. This is the early stage here where these guys are still closed. And pressure, right, is building here and dips down and closes the semilunar valves. Then in our late stage, the semilunar valves are still closed. And now we have our opening of our atrioventricular valves. And so the blood is dripping in. And then we're going to move next into our atrial systole. Okay, and then you can see that also on our ECG here, the P wave, then our QRS complex during our ventricular systole, and then the T is when we have our repolarization here at the start, and then moves back up into our next P wave. All right, so and then this is the same, basically the same thing. It's taking the ECG and it is relating it to what we just saw, the atrial diastole and ventricular diastole. Remember that is this area here because it's before the P wave. Then we see our systole of our atrium, and then we see ventricular systole here starting with our QRS complex. And then we see a diastole of both atria and the ventricle. Our atria is already in diastole here, while our ventricle is in systole. All right, so let's take a quick look at the heart sounds. So one of the simplest ways to see how the heart is doing is by using a stethoscope and listening to the heart sounds. In a normal healthy heart, there are only two audible heart sounds, so S1 and S2. S1 is a sound created by the closing of the atrioventricular valves. Okay, so the closing of the atrioventricular valves, one between the atria and the ventricles, which are the tricuspid and the bicuspid, during ventricular contraction. So during that part that we were talking about, the first part, the first phase of ventricular systole, when those valves close, because there's enough pressure in the ventricles to close those valves, we hear that first sound, the S1, and that's described as a lub. So that sound is what is called as lub. The second heart sound, S2, is the sound of the closing of the semilunar valves then during ventricular diastole. So then we have our ventricular ejection when the blood is going out, and then when the pressure is decreased in the ventricles, so they start to relax, so ventricular diastole. Then remember the blood starts to flow back toward the heart, kind of drip down those large vessels, and then close up our semilunar valves. So then that's the closing of the semilunar valves, and that's dub. So it's lub-dub, lub-dub, lub-dub. In both cases, as the valves close, the openings within the atrioventricular septum guarded by the valves will become reduced. Blood flow is more turbulent until the valves are fully closed. So there is a third heart sound, S3, rarely heard in healthy individuals, but this may be the sound of blood flowing into the atria. So sometimes that can be heard either flowing into the atria or just sloshing back and forth in the ventricle, or even tensing of the chordae tendineae. S3 may be heard in youth, some athletes, and pregnant women. If it is heard later in life, it may indicate congestive heart failure. So S3 is not typically heard, but can be at some points in life. It says here, some cardiologists refer to S1, S2, and S3 sounds as a Kentucky gallop, because it sounds kind of like a galloping horse. And then there's a fourth sound as well, which is S4, and it results from the contraction of the atria pushing blood into a stiff or hypertrophic ventricle. So this indicates failure of the left ventricle. So if it's stiff, then you may hear a squishing or a thump or a pushing of the blood into the ventricle because it's not as pliable. It's not going to go with the sloshing. It's stiffened up. So S4 occurs prior to S1, and then the collective sounds S4, S1, and S2 are referred to by some as the Tennessee Gallop. So if the S3 sound is heard, it's the Kentucky Gallop. If you hear the S4 sound before the S1 and 2, then it's called the Tennessee Gallop, because of their similarity to the sound of a galloping horse, with a different gait this time. So a few individuals have S3 and S4. If that's the case, then it's just generally called S7. So typical normal heart just has S1 and S2, which we call lub and dub, so lub-dub. And you should know that the S1 and the S2 are the heart sounds. You can also call them lub and dub as the first and the second heart sound. The first heart sound, S1 or lub, is when the atrioventricular valves are closing, and that's during ventricular contraction. And then the dub is during the time when the semilunar valves are closing. That's actually what you're hearing, is the semilunar valve closing, that dub. And that's during ventricular diastole. And then you can see that here, the heart sounds and the cardiac cycle. So you can look through this on your own. I think it's pretty clear. Lub, dub, and then the third sometimes heard. And then you can see the different pressures here. Sorry. Lastly, in the heart sounds, there's a murmur. So a heart murmur, which you've probably heard of, is just that term is used to describe an unusual sound coming from the heart that is caused by turbulent flow of blood. So murmurs are graded on a scale of 1 to 6. 1 is the most common, which would also be the most difficult sound to detect because it's more common and is also less serious. And then the most severe is a 6. Phonocardiograms or oscillograms can also be used to record both normal and abnormal sounds using specialized stethoscopes. So during auscultation, it is common practice for the clinician to ask the patient to breathe deeply. Perhaps you have been in a doctor's appointment and you've had a nurse or a doctor ask you to breathe deep and then listen to your heart. This procedure allows not only for them to listen to airflow, but then also they're listening to hear heart murmurs. So the inhalation, when you deeply breathe in, it is a cardiologist or a doctor or a nurse would be able to hear the blood flow into the right side of the heart. So increasing the blood flow into the right side of the heart and increases the amplitude of right side heart murmurs. So they'll be able to listen closely to the right side at that point and see if there's some sloshing of blood or a heart murmur or turbulent flow of blood. Expiration or exhalation, so exhaling, partially restricts blood flow in the left side of the heart and then may amplify that side for heart murmurs. So then down here there's just an image of where a person, doctor, nurse, or whomever, would put the stethoscope in order to listen to those types of things, listening to the mitral valve or bicuspid, listening to the tricuspid valve, listening to the aortic valve and the pulmonary valve to make sure that those are all doing what you would expect them to be doing. All right, so that is the end of our cardiac cycle. You should know all of that information, the different parts of the cycle, the systole, diastole, what's happening in each of those for the atria and the ventricles.